Jumpabietia, Chimafidi non kotu, era one radio. Samupe, Jumpabietia, Chimafidi non kotu, era one radio. Oh, and you pampuma, Asam pampuma.
They are four women. They are beautiful with brains. They are eloquent, decent, wise, and experienced. You have heard many. The funny. Now, it's time to hear the experience and the brainy. Meet Selena, Dorcas, Gifty, and Annette as they present the real in common getting. In common BISS chain, a dead, as in Takrenu assume the dead, the real in common getting. Showing live this and every Sunday, 7 p.m. on Era One Radio on Facebook and on YouTube, Era One Radio and on Taibo channel. Kaise, so we see the real in common getting ya. What brabon tete, we nyan konsa, we the real in common getting.
Hello, good evening, Era One Radio listeners and viewers all over the world. It's a special day today. It's Memorial Holiday in the United States. It's 5:04 Eastern Time here, and I believe it's +4 in Ghana, 9:04, or wherever you are in this part of the day or on this globe, just convert and you are listening to us live on Era One Radio Studio Network. Today I have a very special guest. He's not even a guest. He's the he's the owner of the Era One. He's the sponsor. He's the engineer. He's everything. So it's my privilege to have him here in the studio. Well, I'm going to host him, and he's my special guest, but he's also the sponsor, whatever you want to call it. All right, tonight we are having a special edition of Health is Wealth, Protect It. Normally we do this on Saturdays, but because today is a special day, it's a holiday, we want to honor all military people, including myself, and especially those who have lost their lives on this Memorial Day. So it's going to be a special program. We are broadcasting live on Facebook and YouTube, also Modern Ghana Radio. If you want to join, which I encourage you to do, the best way is to text us. You may call 240-2802-633, but I doubt if you, because the manager who is supposed to be manning the phone is in the studio now, so it's going to be tough. But then you can text us 510-931-0946, and I promise to bring all your messages here for him to answer, and then we'll go about it. All right, as I said earlier on, today is Memorial Day in the USA. Some people are barbecuing, some people are partying and doing all kinds of stuff. But the actual meaning behind the day is far more than, taking a day off or watching movies or enjoying the ice cream or whatever it is. All right, today is observed as a Memorial Holiday. The last Monday of every May in each year has been selected or commemorated as May Day to actually celebrate our fallen heroes. All right, but the funny thing is that yesterday was my birthday, so because of that, the federal government has given us today a holiday. Just go inside it, so just enjoy the holiday on my account. All right, it's here for the American say, and then you me wo Europe bi wo ha nia or share one as here Dr. Osetu to your friend Dr. Ostus and wo friend Dr. Osetu ko bia na new if on kai, but who can also say baby will be no or beje something you special edition of your program here to the Health is Worth. No my yen Saturdays when there special day nti you decide see be na ye pinsem ya hwe how ya promoting health, especially in the share about Ghana situation and we be discussing. But before that, Mami, welcome Dr. Osetu to the studio, and then we'll take it from the doc. You are very much welcome.
Thank you so much, Dr. Boyson. I think let me first say happy birthday to you. I didn't know yesterday was your birthday, but you are so lucky that because of you, we are all at home today. And we thank you for giving us such a day. And also, let me also thank our military men and women, because of them, we are enjoying this kind of peace in this country. So we thank them for everything that they do for the entire nation. Everybody here, we thank them for their services, for the dedication, and everything that their life, giving their life for this country. It's a privilege that we are enjoying this kind of peace, whatever we're enjoying here in this country,
Amen.
because of their services, because of their dedication, their work. They're sick. Some of them been sick about some of them die at the war, but
On the
still
field, yeah.
we are still living. So it's a time that we have to remember and commend them of their service. So I thank them, and I think everybody here in the United States will give a shout out to our servicemen and also our viewers. Let me also say, well, thank you so much because every day, anytime that you hear Semope Asempabiatia, you just click on it and then listen to us. Because of you, that is why Erawan is still in existence. Without you, Erawan wouldn't be where we are. I know it's almost 5 years now when we started Erawan.
That's
Five
true,
years.
yeah.
It's
Yeah.
around 2000 in COVID
COVID,
time.
yeah. COVID
Almost
time,
6 years about. So we thank you so much for always being with us.
Thank you very much. And may I say that our first lady, Sister Abina, wished me happy birthday. So she covered you, so you were not lost. Yeah, she represented you. So that is really, yeah, I mean, I forgive you. I forgive you. All right. Well, the CEO has spoken, and we'll try and blend our dialects today. You know, some of us are from rooted in Ghana, so we want to be fair to our people. We want to switch our mother tongue. You know, somebody will say, why do we have all the languages in? They call them mother tongue, and the person said that is because men were not allowed to speak. So today, but the men will speak today. All right, it's an honor to host the CEO of Erawan Radio. For those of you who don't know him today, you've had the privilege of knowing him. Actually, he comes on several programs. He has his own program that was on Saturday, but because of the time change, you know, he moved from Maryland to California. So the time change is kind of messes him a little bit. But then he also engages on the Monday show, Tonight Show. I'm sure from here he's going to join Kobe on the political conversation. All right, so by simple introduction, Dr. Ozu is an accountant by profession. He's the husband of only one wife because his wife will not allow him to take any more. And they are blessed with, I think, 2 children, I believe. He founded the Erawan Radio around the era of COVID-19 because COVID-19, we were all home, and I think he got bored. And one day he said, oh, I'm going to start a radio station. And because of that, we are here. So not everything that is bad. Because of COVID, which seemed to be bad, now we have Erawan because it was born around that time. He's also a philanthropist and has recently founded the DRWA, Diaspora Works and Relief Agency. It's a non-profit organization that seeks to help less privileged people, especially in Africa. So tonight is a special edition of Health as well, and we dedicate it to the people of Ghana because of what we're going to discuss. All right, so I'm going to start with this. Doc, you are welcome. I have said a little bit of what I know, but if there's anything else that our audience don't know, you can add it before we zoom into our discussion.
Yeah, I think sometimes you need to have something so that the next time you have more to say. So whatever you said about me is enough. So maybe, yeah, I think you made a summary of myself. So
Okay.
I don't think I should add anything more. Otherwise, I will be repeating myself on what you said. So I think that is me. You just
Okay.
said, you know me, so you just said whatever you knew about me. So that is what I think it is okay.
All right.
Now.
Okay. If you say so, we'll take it. All right. So, Doc, we're going to look at later in the program, we're going to be playing some videos for you to throw more light on it. But I'm going to ask, what have you noticed or observed to be Ghana's major problem when it comes to healthcare? Say, if I say Ghana, Pomudin Seminar, your hospitals are binding, but they're now sharp. Yes, some of the problems are, discussed. What are some of the challenges or problems that you have noticed? We want to warm up from there before we get into our conversation itself.
Yeah, I think before answering that question, let's look at what is going on right now in the domain of Ghana health system.
Okay.
What the government is doing, because even if we have challenges and difficulties, it all lies on the government because the government not obey BBA. So in the first place, what I would say is that within the 2026, the government they have a universal health coverage That is the expansion of a national health insurance scheme. And then
Okay.
um, talking about digital system, health transformation system, and primary healthcare system. Why that? Because we have some challenges in these areas. That's why I think the government wanted to expand this area of national health insurance authority system, and then a digital health transformation and primary healthcare system. You see, because there was certain the kind of problems within this kind of areas, the government wanted to expand it or increase it. When we talk about health insurance system, that maybe that would be the area where we'll talk about. And then digital transformation. You know, most of us here in the United States, we have a lot of our data in a digital system. By Ghana, sometimes it becomes difficult to even when you try to retrieve people's information, it becomes so difficult. So the government want to embark upon that, and also the primary healthcare system, access to primary healthcare is also one of those things. In Ghana, we are aware that having access to primary healthcare is one of the challenges that Ghana is going through. Because sometimes you go to somebody may be sick, and trying to get access to healthcare becomes a problem, even in our rural areas, especially. So I think the government wanted to do this, and also free primary healthcare. The government wanted to bring this kind of initiative to Ghana, so people have easy access to insurance. So some of this program might will be focused on maternal and child health care, immunization, diabetes, and hypertension screening,
Okay.
and then cancer screening, rural health outreach, and treatment of common illness. So these are some of the things that I think is going on in Ghana, and I know it's a challenge that Ghanaians are going through, or we Ghanaians, our parents, our sisters, and siblings back home are going through. So another thing that is happening is that the National Health Insurance Scheme, the government wanted to expand it. Why? Because the government want everybody to have access to healthcare. When you are sick, at least when you get to the hospital, you have care. So it's also another thing that is going on. It's all about, because we have issues, and I know National Health Insurance, when they started, I was there. I was then administrator of SD Hospital in Sunyani. I know how the whole thing started and the challenges that they went through. But I know now things are improving. It's all about our health. It's all about our health. So, and I think the government also looking at the mobile and digital renewal of this NHIS, so people can just pick up on their phone and start to register for health insurance. It makes it easier for them to renew and then register. When it comes to the next level, I will talk about it, what I've seen when I started doing DWI regarding
Okay.
this
That's fine.
insurance kind of thing. And then because of that, the government has, within the 2026 budget, the government has given about 34 billion, 34 billion, which is a big 34
B,
billion Ghana cedis.
B as in Bravo.
Are allocated for this kind of this initiative that I mentioned, meaning that we have a lot of challenges in Ghana health sector. We have a lot of challenges. But I'm thinking that even this budget is very small. And then the major allocation to that is that how about 11 billion for national health insurance, 11 billion, and then
Billion.
1.5 billion for free primary health care, and then 2.3 billion for Ghana Medical Trust. Well, I think the government wanted also, apart from NHS, there's also Ghana Health
national.
Trust that the government has put in place, so that people
Wow.
with big, maybe like say cancer or whatever, apart from
Okay,
primary
those
health care,
chronic
they can
disease
also go there and get
treatment.
their health. And talking about digital health and AI, we're talking about AI, right? Because now we have to shift our focus on that area so that we're able to organize or do things very faster. I mentioned about data in Ghana system. If you are sick and you go to the health service or any health center, and they are looking for your data, it becomes problem. I mean,
Okay,
from
the
one
information.
hospital to another, you have to go there, fill the same application again.
Because the records are not syncing.
They are not synchronizing. They are not
Okay.
together. But now they are trying to make in a way that, like here, any hospital you find yourself, once you have
Put the
your Ghana card,
information.
they should be able to get your information. And then also our history, because we have separate documentation of our health. We don't even have one history. So it becomes
Centralized.
difficult for doctors to know exactly what is happening to you.
Your history, yeah.
Yes,
Mhm.
because you have some history here in this hospital, another one in this hospital.
So it's
But
like they
in
have
this
to start
case,
all over again.
yes. So digitally, we got everything together. So whenever you get to the hospital, the doctors will say, okay, they look at your history and then they know where they are coming from or
That
where
is,
to
yeah,
start.
a
Because
continuum of
in here,
service.
yeah, in United States, they will ask about your parents, all this kind of history, so that it helps them to put pieces together to know what is happening to the patient. So I think moving forward with that direction is something that will help. It was a problem because data accumulation becomes is a problem in Ghana health service. So let me chip in here, and then maybe we can discuss about some of those things. And
Yeah, we'll come there. I don't want you to, drink all the soup right now. Just hold on with that information. We'll come to where you have to come in. But I'm just trying to warm up. You give us all that details. But I want to ask you, mentioned all these problems, the continuum of service, what the government is doing. And with all that said, I mean, in India, I on one understand the problems or one statistics of all the money that the government has pumped in. That is very, impressive. But now let me ask you about the residents themselves. The government has its own challenges or problems. What does the individual, the resident, himself or herself have in relation to health problem? I can say education is one of them. I mean, finding out whether I have to go for vaccination, do I even have records of vaccination? That is a problem. What do you think is the major problem for the individual themselves as far as healthcare is concerned?
yeah, I think the major problem with individual is that it seems like our health is for the government.
Okay.
It's like if I'm sick, is the government is
Responsibility.
obliged to take care of me.
Yeah,
Instead of me
their
thinking of myself that
responsibility.
I'm sick, I have to take my own responsibility of me and my hands and moving forward. The person will be sitting down there thinking that the government has to come and carry that person
To
to
the
the hospital.
hospital.
And because of that is what we're having a lot of issues. If we think that okay, I have my own body, yeah, so if
Exactly.
I'm
It's
sick,
yours.
I should take the first step, right, to move on to take, or even before I have to have preventive measures. I
That's
have to
true.
prevent myself so that I will not put myself into that kind of. But in most cases, situations that every Ghanaian individual can prevent, we tend to lose just turn side of it
Ignorance. Yeah.
and expecting the government to come in to prevent us. And these are some of the things that I think as individuals we should like we said, health is wealth. Our
Yeah.
body, our health is wealth. We have
Protect
to
it.
value
Yeah.
our health more than anything. We are people who always wait for somebody to come and give an instruction to do something, and
So in
because of
that,
that we have
if I'm
extended.
hearing right, what we are saying is that it's like what person are buying the baby sow say Kwame, oh yari and I say oh yari. Yeah, I buying the baby sow. It's all we be taking approach, taking the
That
initiative about your health. No, we are
You are
waiting.
right. That is how it is. Because sometimes said American Nipakwano will sit down there or yare, but on take any initiative.
Initiative.
The health insurance will on take initiative. Even just go out there to register for health insurance, what becomes another problem for that person.
Problem.
Thinking that he has to busy go out there to go and work instead of thinking of some people will sit down, their kids will be sick, instead of take the child to the hospital or be person or Juma, leaving the child at home. You see, so these are some of the things that individuals can do. Even preventive measures that I was talking about. What if you baller, what did you ballers you once ago? Take it no, he want the
Some standard.
government to. What I say? He said, ensure to wash your baller into the. You see,
Stream of
all these are
water.
some of the measures we individual can prevent it.
That's true.
We are still would and to can go up to it, but no, we are not what to go. Mosquitoes about betukushiyagum, and later we find ourselves in all this. So individual we can prevent ourselves first before government putting all this budget into it. Now let me another, I mean, chipping some of the problem challenges that Ghana is
Facing.
going through. We have
Okay.
a no bed syndrome in Ghana.
Hmm.
No bed syndrome in Ghana. And also, maternal mortality is also
Low.
another challenge we have here. And also, health worker unemployment is also
Hmm.
another challenge I've been hearing. I recently had one guy, a friend called me. He's in Maryland. He called me and he said he has a sister who has completed nursing school for 3 years or 5 years now.
Onyejuma.
No job for the guy. She sent me the lady's information and everything to see if I can get somebody to talk to so they can put this
Employ
guy.
her.
You see, can you imagine that? Thinking that she's not the only person. We have a lot of students or ladies or men, nursing professionals who have completed school but no job for them. It's one of the problems. And then rural healthcare gaps, the gap between the rural and then the urban areas is also happening because most of the doctors too, when they
Hmm.
complete school and sending them there, they refuse to go there to help
Yeah.
because they think that's a rural
Because
area. So
the
these are some of the
area.
challenges I think Ghana is going through. If you look at these three that I mentioned, there's no bear syndrome is serious, and this unemployment situation too. It's one of those things that I think Ghana is facing, and that is why the government has given this kind chunk of money, 34 billion Ghana cedis, to support this kind of a challenge. But like you said, the most important thing is we as individuals in Ghana should be able to, if the government is just putting on this budget, we have to help the government. Otherwise, this budget will not do anything. We as individuals also have to prevent ourselves from being sick. There are a lot of measures we can do, but in most cases, we don't. It's like I don't know why Ghanaians we tend to
Well, sitting
hand
there, look.
us things.
Well, you've said a lot, a mouthful of information. I believe whatever you said could be a motivation for what you started. But I'm going to allow you to speak in your own words. That what actually I know from the snippets of what you said, we can gather why you came out with this dream. But then tell us in your own words, what was the motivating factor that pushed you into this health insurance for our people?
Okay, thank you so much. I think that's the first question everybody will ask. Why that? You see, I remember when I was a child, among my siblings, and I was the only guy na me pay a pa.
One can pay area.
Oh yeah, 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 yeah.
Well, pay area.
For the Americans are na me yare because among my siblings, always you see them, they are all strong, and I remember those days, when I was in primary school, now you go school twice, 12 o'clock, and then you go and come back.
Also pay area.
So, and if I was able to go to school only in the morning. In the afternoon, now I see people that you're fufu. It was malaria.
Okay.
Not malaria. I'm talking about malaria.
Mosquito, yeah.
Mosquitoes. You see, because I hate mosquitoes than anything, any animal in this world. I don't like mosquitoes. Where mosquitoes are, no, I don't want to approach them because if I have any one bite from mosquito, I'll be
Oh.
yes. And see, coming down here, even from that young age, mosquito, any bite, I
I'm a
had a
pill.
problem.
I'm
But
a
when I came
no.
here, that is why I'm so healthy here because of
You
that.
see, Yamina don't do a bit here.
Yes. So I realized that I remember one time too when there was no money for my mom. That time there wasn't national health insurance.
Okay.
Somebody called cash and carry. If you don't have money, then you are going to die. You don't have health care. So as growing up, it was in my mind that what can I do to help one day? So I thought of okay, then the only thing I can do is to provide free health insurance for this case
Those
in the rural
less.
areas where I lived among myself. Because I didn't even know that people needed it much. But I thought it was free. Health insurance it wasn't all that bad. Then I thought people would go in to do to have their cards. But when I
Okay.
started, surprisingly, the first one that we started, I was surprised to see a lot of people. going in there to have their insurance either renew or having a new one. So I asked myself, what is going on here? You see, initially I thought people, but then later I realized people, anytime we set a tent or we open up, people just jump in there and trying to go there. Many people need it. But then going there, like I was, we even all of this, some people will not even go. Some people will not even go and do it. Even it's free. They will just have to go. They will go to their farm and leave it. But the idea why the question, the idea was that I wanted to help people. I wanted to help the young ones because I found myself in that street before. So I was thinking that if I'm able to help a child 1 year to have access to healthcare, have insurance, I think that child will grow up to be somebody in the future. So that was the main reason that I wanted to help, to support. Because in my own case, it wasn't easy for me. I wanted to go to school, but I couldn't go because of malaria would put me down. So I didn't want it to happen to any child like me anymore.
Thank you very much. It's so interesting that sometimes if God wants to use somebody for something, he makes the person go through the situation so they will appreciate it more. Because if you haven't been poor before, you don't understand what poverty means. But then for those of us who have experienced poverty, to make us say, I'm coffee, and then we be also Charlie means sending with $50, $100, and because you were going through all this malaria sickness, you understand what it means for somebody. Because even if you give somebody educational scholarship and the person doesn't have the good health, they can't even go to school to go and study. So that would be useless. But once your health is intact, you can do anything. So that is a very good thing.
Because you know what, those times, I sometimes I was young, but I was asking God, why me? Because I knew I realized my brother was strong.
If not you, who?
You were the one that would do it. My brother was strong. My other two brothers, very strong. My sisters, I was the only guy, always. So I just, as a young guy, I was as if, why? You see, but like you were saying, maybe there's a reason for that.
Everything, that's
and now I remember that. I think I should, if I can help to protect a child, when I go hospital, I'll be to me. I need healthcare. I have to, in my own small way, I have to help.
That is good.
It's just about giving back to the community.
Exactly, paying back. And I believe God is going to bless you to have more, and then others will chip in. All right, so let's take a quick break. I'm going to play one of your videos. And then when we come back, you tell us about DWRA and how this thing was birthed and how that links to this voluntary thing or beneficial thing that you are doing. All right, stay tuned. Don't go anywhere.
Every child deserves the chance to grow up healthy. In Ghana, many vulnerable children and families struggle to afford basic health insurance. That means sickness can quickly become a crisis. Diaspora Works and Relief Agency, also known as DWRA, is helping change that. Working with Ghana's National Health Insurance Scheme, DWRA helps provide free health insurance access for children in need and supports communities through real outreach on the ground. Your donation can help protect a child's health, restore hope to families, and expand this life-changing work. To give today, call 559-767-1593, email dwrac@gmail.com, send Cash App to $DRAF, or send Zelle to DRAF. Donate today and help protect a child's health and future. Diaspora Works and Relief Agency. Compassion in action.
Chimafidi nunkotu era one radio. Samupe jumpe dietia. Chimafidi nunkotu era one radio. Oh, ayumpankuma. Chimtu asampankuma. Chimtu agratumkuma. Era one. Yebo yumpankuma.
Well, we are back. In case you just joined us, you are watching the Era One Radio Network. This is the Health is Wealth Protected version of our production. This is normally what we do on Saturdays, but today I said we're doing a special program to commemorate a Memorial Holiday and also to provide some education for our people in Ghana. Well, before the jingle, Dr. Setitu was telling about some of the major observations of problems that is seen in Ghana, and then the individuals issue problems as citizens concerning health insurance. And so I did play a video of some of the work he's been doing. So I'm going to let him actually tell us more about the DWRA, how he came about with it, and how we can launch in and the future of that DWRA. So Doc, over to you.
Yeah, thank you so much, Dr. Boyson. I think the genesis of this, I think I registered this business in Maryland before I even came here.
Okay.
Initially, I wanted to start with the students, try to help us young. All back when son was the youth, the young, the little ones, because as I mentioned, my experience. So I realized that the diaspora are the people outside Ghana. So I was thinking that with the diasporans outside, we can help. So that's why I make Diaspora Works and Relief Agency.
Okay.
Diaspora, our works can relieve people back home. So I have the name Diaspora Works and Relief Agency, meaning that our contribution can help a lot, can relieve a child, can support a child. So that was the idea that came out with that kind of name. But you see, Diaspora Works, I set it up because I wanted to help the youth and then the elderly, the young ones, and those the few, the vulnerable one in outside back home. So the idea was to set it up here so that all of us out in the diaspora, wherever you are, you can contribute to support somebody back home. Because I know that if you look at the economic system in Ghana, the health sector in Ghana, a lot of things are going on. And sometimes it becomes difficult for a man on Colano, so many have access to health care. And the idea, like I mentioned, was to at least donate something small, even if it's $1 to support a child, is good. To save a child, every child be access to health care. Because in most cases, what I realized was sickness. In my case, because sickness, I couldn't go to school in the afternoons. So what about a child? Over 30 years ago, and the same situation still persists.
Still exists, yeah.
What can I do to at least to reduce it? If I can't fight everything, but what can I do to reduce that cost? Or to help a child? Some of if or you're and man beat me in a hospital. And like I said, to my surprise, we have a lot of parents bringing their case to renew their insurance. Some of them, but for the records that I received shows that some of them insurance have expired for a long time. Parents could not renew. So the question was, suppose that between that period, if this child was sick, what would happen to this mother or to this child? So we jump in to support, to help. We can't do everything, but the feedback
the videos might
was very fantastic, which I think I realized that what I'm doing is good, and it will support, to help go a long way to help some case.
Yeah. Thank you. Well, he's rightly said it, and in Ghana we have an adage that says, "Say, obi food your pa any piano." Inti said you doctors so offer no eduapa. Inti nyambo na yen piano kodustru na ontumi achieve no famboa the less privilege, because I can imagine if some of us were still back there, would have gone through similar situations. So if you happen to find yourself in a place where you are a little better than the less privileged, the onus falls on us to also try and help. All right, so Doc, South Vision way they are very big, because what kind of a huge venture person trying to provide health insurance and healthcare for all those people. Even if say 100 people cry, it's a lot of work. So now the question becomes, what are the strategies? You've given us a vision why you started DWRA and what you intend to do. But what are the strategies you want to put in place to make sure this thing can come to pass? Because it looks like a Herculean vision, a big power because
Yeah.
it's not small money. What are the strategies? Would they first lady Abinada, oh sorry, then officer Abina, when necessary, what are the strategies you think you can push through to get this home?
Yeah. So right now, everything is about money.
Money,
Yeah,
yeah.
this even if we can put all the structure down without money, it can work.
That's
So
true.
in our own small way, we are contributing families trying to. So right now, I've set up some. I have a website. We have a website,
Okay.
and then we have other we created other
Links and
flyers to let
okay.
people know of us. We have a YouTube page for that, Facebook page for that. We have LinkedIn page for that. It's all
Wow.
about marketing for people to be aware of the ECOS because this is an NGO and
Okay.
it's not one person business. It's about people collectively. It's a diaspora putting up, trying to support this. I said that the idea was I was trying to set this up. That is why it wasn't only for Ghana
Okay.
because we're trying to see where we can have other resources and funds. So we're trying to have in a way that US is also part of it. So
Okay.
that if in the future we're trying to assess other grant also to support this in a bigger level. So I started trying to apply for some grant, writing some document, try to do all of that. That strategy is also there that I'm working on it. That only that it takes some time
Takes time.
before you can get something out of that. You need to make sure that the pieces are in correct shape.
Place.
One is legally registered,
Okay.
and now we also have a 501c, which is
Yes.
the document that qualifies you to
For
be
RS. It's
yes
tax free and all
yes.
that.
So we have that document. So whoever if somebody contribute can give the person tax relief back to
Break.
yeah.
Oh, okay.
So it's officially registered legally. Everything is for that paperwork. Everything is done. So
Okay,
right
legit.
now, the step that we are moving on is that we are talking to individuals with friends
Okay.
who can support us and at the same time try to expand it. The next level will be getting this grant. Also, I started trying to put on application to some of these grants. So we are praying that one day it's we'll get some grant to expand it to
Massive.
do more than what we expected. And it's not only about life insurance. We are thinking of in the future, we have to have a children's hospital in Ghana.
Wow.
That is the idea. We use this as we gather more money. We have to have a children's hospital. Like we have a Jude hospital here for children's hospital.
Yeah, yeah.
That is
St.
what is
Jude.
in my mind right now. We should
That's a
have a
vision.
special just for kids. For kids. That is my plan.
Hey.
And
We
that
when I
is where
maybe I make my wife say if I said what one day was Sudan when you're five sure be no could channel billion.
when I bet to America, they
Oh,
acquire the also
skill
the way.
boomby, skill
Actually,
boomby.
that
Oh.
is my goal. And let me also chip in there. And then back where it pushing me pa, it hurting me yet. When my junior brother, one next to me, died,
Died. Okay, that was it.
it
Yeah.
hurt me more than anything.
And that could have been prevented, you know.
Yes, because I look at it's always it pushes me. If I remember me, brother, so always I have that idea. Say one day, I need to do something to help normal be a course over your mother your team. That is why I'm thinking about this. But I
Yeah,
hope say
you are right because some of these medical issues that we're going to for lose some life, yeah, they are issues that can be prevented.
oh
Because
yeah,
recently, mom be an quite sorry, or mommy car baby Nancy, I mean, woman on shed in the but also call him for Kofodia. The hospital didn't have, I think, MRI machine.
yep.
MRI machine measure what is going on. They
Mhm.
didn't have it. They have to keep postponing, transferring, and the lady died. Something that could have easily been scanned within a
Right.
short momentary time and figure out what is. I mean, and these are some of the things we have to look to. I mean, we are saying you equivalent hospital now having equipments to be easily used to diagnose medical issues. I mean, our people are dying over very, very simple things that are preventable. Very, very
Because
preventable.
you see, always we say nyame there are certain things it's not about God. And God has no hands in it. There's certain thing God has no hands in it. It's our own decision and things that we do. And to say what we are talking about. There's certain things we can prevent on our own, but because of either our own negligence or something, not a
That's true.
focus. So they pray like nurse and doctors, they are ready to do, but certain things and maybe in so. That is why those of us outside diaspora, those who are outside are the privilege. We need to support some of
Yeah.
these initiatives that people are. It's not me only. We have other people also doing
Similar things, yeah.
different things to make sure say back home a normal air cost, because like we talked about it, the soldiers in this country fought for this country. That's why we have that privilege. We
Freedom,
should
yeah.
also do the same thing, fight for our country. Collectively, we can do a lot. We can do a lot. And that's why we set this our organization up there. At least mobilize I set up organization, but our contribution to it can go
Kakra
a
now,
long
be
way
a
to save a
kakra,
child.
yeah.
Maybe $1, $10,
Exactly. Because
$10.
we never back home to me yet into be a kakra because even Ghanaians some good diaspora your doors pa.
Yeah.
When you be a even just $1 per, it will go a
$1
long way.
it will go a
A
long way.
very long way.
See,
Long way.
that is why. Yeah.
All right, let me play one more video and then we'll take it from there. I know we are going, we have about 17 minutes, but we'll do what we can. Let me play one more video and then we'll take it.
Every child deserves the chance to grow up healthy, protected, and full of hope. In Ghana, too many children and families still struggle to access the health coverage they need when sickness comes. Through the leadership of Dr. Samuel Osei Tutu, Diaspora Works and Relief Agency, known as DWRA, is helping change that story. In collaboration with Ghana's National Health Insurance Scheme, DWRA is working to help provide free health insurance access for children in need and to support families through direct community outreach. Behind every number is a real child, a real mother, and a real family praying for help. Your donation can make that help possible. Your support can expand registration efforts, reach more vulnerable children, and protect more futures. You can donate today by calling 559-767-1593, by emailing dwrac@gmail.com, by sending Cash App to DRAF, or by sending Zelle to DRAF. Please give today and stand with Dr. Samuel Osei Tutu, DWRA, and their mission to help protect the health and future of children in Ghana. Diaspora Works and Relief Agency. Compassion, partnership, and hope in action.
All right, Doc, I'm saying, yeah, what kind of partnership and how we can get the diasporans help. But then if we throw our mind back to Ghana, is there any agency, any I know NDC is in power now. I don't want to go into too much politics.
We are not in politics now.
Into politics, but I want to ask that: is there any agency you are trying to link up with them? Because of course, like you rightly said, we can't do it on your own from this end. It has to be also those on the ground. Are there any governmental agencies that you are trying to link up with? Let's say health insurance company who can also help and give lower premiums or discount that will help this vision come together.
Yeah, thank you so much for the question. What I did was, I need to get some people at home, because I'm not there. Yeah, on to me, I ran it, to mobilize the community. So the strategy was first to talk to the National Health Insurance. So in this now I've done in Mampong Ashanti community. So I called I found the number of the manager, and I spoke to him that this is what I wanted to do. And he said, okay, that's fine. So after negotiation, he said that they will help me do that. Whatever amount I want to deposit into the account, if I pay, then they'll go out there. He'll make sure that he'll send some officers to go and do it. I said, fine. So they gave me their bank account information. I had agreement with them. So I have to just pay the money into the accounts. Immediately they get the money, we set up a date, then they go there and do. So one, I'm working with the National Health Insurance in the area. And then two, I also contact the assemblyman, the committee, I think they have an assemblyman and then a committee chairman in a community, in each of these communities. So I talk to them that because I want them also help me to mobilize the people, because without them I can't mobilize them. So I talked to the assemblyman, I talked to the committee chairman or the secretary in that community. So they will mobilize the people. They will make an announcement so that
Okay.
people, the people will just come in there to have their services. So to have work with the National Health Insurance and then also the community leaders. I haven't talked to the chiefs, but I've talked to the assemblymen and then the community, because they are in charge of the community. I did that because they will be able to make announcement, call people together to come and to come for the health insurance. So that is what I've been doing for now. And maybe in the future, what I intend to do is I'll get this either a nurse or community health nurse, because I'm thinking of this kind of an education they have to give to the people when they gather together their health insurance preventive measures that we're talking about. So I'm thinking of having another person going in there with them, either a nurse or community health nurse, to educate them on
Okay.
some of this health preventive measurement that we are talking about. I also have a guy that I spoke. He was the center of it. When I talked to him, he gave me all this contact to talk to. He is there, and then this another guy who also do the pictures, and then they shoot all these videos. So we have
Okay.
this poster. So I have two guys there. Right now, I'm trying to add my brother to it so that he'll be he'll be able
Amen.
to mobilize everything for me at home right now. So that right now, that's the team I have back home that are helping me to do it.
Thank you very much. That is very laudable. And I also just want to chip in that, well, you can be visiting some hospitals, and I know there are hospitals that use equipment for maybe 1, 2, or 3 years,
Yeah.
and they want to get rid of it or take it back. We can talk to them if they have machines that we can easily ship.
Oh yeah.
We can just ship some of these equipments to the hospital. So whilst we're waiting to build a facility equivalent to St. Jude, you can have some of this equipment that can be shipped to, to help the hospital. So like I said, these friends who mom were passed because of lack of equipment, that is also laudable. So if you are listening to us, if you're a hospital, you are a hospital administrator, you say, hey, if you use this MRI, this scanning machine for a couple of years and it's still working, we want to renew our contract, we want to get rid of it. If you want to come pick it up, we will send our own vehicle and come and pick it up and help, because any small way that we can to make this thing grow, we have to do until the facility is built. At least this will go a long way to help. All right. So now I put in a what is it? I posted something there. I think the link to contribute, I think it's the $ DWRAGH, if I'm
Yeah.
not mistaken. So you can also type in whatever for me. But I put that in there. Anybody listening to us, please. That is, I think, the Cash App link. That, like we said, nothing is too small. Ghana,
Right.
maybe a castle. Don't say, oh, yeah, I only have $1, so it's not enough. On this platform, we don't ask for money. These are some of the contributions we make to go and help somebody. So just imagine yourself being on that end of the pool, where you don't have that privilege. Of course, here we are blessed to have, most of us, our work employers and all that have insurance. So you are, although you pay a little bit, you have that peace of mind. You don't go to bed stressed that, hey, if I fall sick tomorrow, I'm going to die or something. You know that even if you call 911, they are not going to, like a dog said, they are not going to ask you money pay before service. They will give you service and then you pay. But if you don't pay, they will find a way to get it from you if they have to get it. But then they will not let money come before your death. They will make sure 911 will come and pick you. They will treat you, and then after that, they will give you your bill. And of course, people pay, so that's no issue. But like he said, Ghana, sometimes you go and because they think people will not pay, they will ask you for money before payment, for treatment. And by the time they ask for money and you are pulling the money you are calling your uncle from the bill, by the time you come, your vital signs of all tanked down and you are ready to go. So that is the difference between what a developed and a developing country. I think, and I pray that our leaders will have different mindset and changes of ideas and attitudes that realize that, let's put premium on life better than money. When somebody is in need, of course, there are people who, every now and then they will fake, not faking, but then they are not sure what you are doing. But then let's provide health service. Life is better than all this money. Because the funny thing is that when people die, we go to their funerals and we donate all this huge money. But when they were alive, they will ask for $1 and nobody will give them. So whilst they are alive, let's help them to stay longer instead of waiting for them to die and go and sing all these obituaries and may stay and pay money. All right, we've spoken at length. So right now on the home front, here front, I think what we can do as individuals, on the doc have spoken too much. He doesn't have to go on his knees and beg before we help. You know who you are, and you know how much God has blessed you. Filling it with $1, $2, $5, $10 will not hurt your pocket. Just say, okay, one day I'm going to fast from McDonald's. I'll not eat lunch, and just help so that the money is not going to his pocket to go and chop or whatever, buy it. It is going to help. And he has told you his story, how as a child he suffered from malaria, something that we don't experience here. I mean, I don't even know when anybody was bit by a mosquito here, because why? There's the same, as Jonas will say, the system is working. The system is working. We have to also try and help. All right, so the format, I think the advert, but I don't know whether we'll be doing more of these discussions. We want to make sure everybody hears about this discussion, how we can help to make this a success. So the cash, whatever app is I put in the studio, the platform, you can say, hey, Dr. Osus, I heard your broadcast and I want to contribute. Please share this broadcast. Just go to Facebook, go to YouTube, see the video, and just click on that thing that shows like an arrow. Click on it and share with your friends. Let them listen and let them be inspired and also help. We are all going to do our own small way to help this project. This is baby. I mean, he gave birth to the baby, but then, as you know, it takes a village to raise a baby. The fact that he brought the vision up doesn't mean to forget you. He brought a baby and a whole community. We have to make sure this baby grows. The baby is going to be drinking milk from the mother's breast milk or whatever. In this case, it doesn't have a breast, but it's the baby. The baby will grow, and we want to make sure this vision grows. And we all consider, hey, I was able to contribute. If in the future, if he builds his hospital, I can. So I was there when we did the interview to let the people know about. Yeah, we all be recipients of this joy. So please share the broadcast. I know some people don't listen whilst we are doing live, but it's always going to be on Facebook, YouTube. Please share it to your friends and let them also think about helping this venture. We want to see this baby grow. All right, I think we've talked about the format. Apart from the Cash App, is there any other link? Viewers,
yeah, I think we have there's also Zelle, Cash App,
okay.
and then if you call my number 559-767-1593.
Okay, let me put the number that I'm typing in. Is this
559?
Is this thing frozen?
Yeah. If you go 559-767-1593, you can get me. And we're also looking for
Let me take it again. 559
767
767
1593.
1593.
Yeah.
Okay.
And we are also looking for partners. If you want to be partner with us, because in any form, we are ready to partner with people so that or either organization or whatever. We wanted to make this thing big to help our country. So
Okay.
let me use this opportunity to thank some people that have helped me. Dr. Douglas Boachi has been helpful to, and then Dr. Zeke Steve has also been good too, and then Dr. What's the name? I'd have to mention. Yeah, one doctor have also been helping me a lot. Although they have helped me a lot to make sure that this thing is moving on. Dr. Prosper Toku of Virginia.
Okay. Virginia.
Yeah, Virginia, and Dr. Zeke of Massachusetts, and then Dr. Boachi of California. These three individuals and any other person who have contributed to make this program a success. I think I need to commend you guys. And my own wife behind the scene, Mamia Benafilimpama, she's driving this year as we are moving out. So I thank her so much for her support and everything that she does to make this DWRA a successful one. And I know others have contacted me too that they wanted to support. So I'm still waiting for their support and their contribution to make sure that we move forward with this dream that we are thinking of today.
All right. Thank you. Well, I don't know whether the other videos are the same, but I'll play one more and then Dr. Osis will give us the closing remarks, and then we'll call it a night. But of course, we're going to be coming back every now and then, so stay tuned. All right.
Hello, everyone. You are welcome to Coffee Black TV. We are here because Dr. Samuel Osietutu believes in health matters through partnership with Diaspora Works, Relief Agency in USA, and the National Health Insurance Authority. They are here to support Chechire, Apa, Yonso, and communities across Mampong municipality with free national health insurance. So, we've got folks from Chechire who have benefited from this initiative. Let's go straight to their stories.
Yentia yetwehye me a medina ha me kasa yefrɛ me Francis Ochre na yentia yetwehye ha nye bibia sɛ yenya yenua ye papa Dr. Osietutu a wo ama no ne na wahu sɛ apomdin hu nsɛm hianti ikro chichiwere ɔde apomdin suefo aba sɛ obia woni health insurance ra na be health insurance ni free sɛ de be ya apomdin hu nsɛm so ɛbɛkɔso nti wohunu ɔmanfo bebra twahye ha yi a na nye obia sɛ Dr. Osietutu ɔno a yi afiri ni pem na wama manfo nyina ba sɛ obia mɛgye health insurance sɛ de be ya na apomdin bɛkɔso nti na ɔmanfo yɛ twahye mu ha nti muhu ya ha na no kwai ya no de sɛm a
Dr. Osietutu yɛda wase nyame nhyira sɛ wama apomdin asoɛfo aba sɛ ɔmmɛyɛ health insurance ma yɛ. Nyame nhyira wo paa sɛ yɛ mɔborɔfoɔ yɛkɔ hospital yɛ nneɛma bɛkɔ fam ama yɛn yɛda wase nyame nhyira
oni ososu to asise aba yɛ no insurance nipa udu ona ebi ya baby asise insurance.
Well, just like you saw in the video, you can tell that people need help. Those who need medical help, those who need dental insurance, they are all our people need help. There are some people who I believe in their whole life that they haven't even seen a dentist before. That is very important. And in Ghana, there's this tradition that if you are not sick, you don't go to a doctor. That is not the case. Here, you'll be mandated to go see your doctor. I mean, I just had my annual physicals 2 weeks ago. Every birth month, every May of my year, I have to do my checkup. And that is how you can track if you are beginning to grow any chronic disease. If you don't go, you wait till you are sick before. By the time you get it, they say, oh, you have cocoa, which started about 3 years ago because you haven't gone. Every year, at the minimum, you have to go see your provider and schedule, do your labs. I mean, I know we've done several programs or what is the presentation on this platform. I mean, knowing your numbers, where your lab numbers, when you subject your blood, when you draw your blood, you have to know what your CBC is, what your sodium is. We are eating all this salt and all kinds of food, and you don't know what is going into your system. So you have to know. Please don't wait till you are sick before you go. Every year at a minimum. Just make it a project that every year on my birthday, plus or minus 1 week or whatever, I'm going to see the doctor. I'm here. I'm not currently sick, but I want you to look inside my body and tell me something I'm going to develop in a few years. That is how people don't do, and they go and it's too late. So please, this is the vision that Dr. Osietutu is coming out with. He wants to make sure people are taken care of, to know what is going in their body before they tell them you have cancer, whatever it is. Doc, thank you for gracing our show. But I want you to maybe give us your closing remarks before we wrap up.
Yeah, and my main fact, let me thank you so much for bringing me to this show. It's one of the shows that Rawat Mortimer I hold up to this time. And let me thank you so much. You guys were still using this program sometime. My wife, until program is yes, Dr. Boyce, one Dr. Boyce alive and Rawat will still be there. But, you know, Dr. Boyce and Rawat will never go away. And I just want to thank you so much, Munia Kobe, for holding on to. And I know it's at the right time, no. Maybe who knows? Thinking of expanded certain things to make sure everyone made me and so push it up to where it is. That must enough. So, Mama, support DWRA, and so we. Also saying, say, our doors are open. We need a lot of help. We need people to come and support us so that we can grow to get to where we wanted to be. Without their support, we can't do anything. One man cannot do it. And I want to say, Ghanaians need our help. Those in the diaspora need our help, because looking at this video, that's my own village.
Okay.
My own village. Can you believe that they don't even know me? Say it was me.
But they
don't even know say it's me. Actually, the first guy now, my brother was the one when I had my brother. I mean, next to my brother, my biological brother.
Oh, okay.
Yeah, meaning and it's something that I think we're trying to expand this to all Ghana, but we are starting from somewhere and try it. The more funds we get, the more we're able to do to make sure the feeble, the vulnerable ones, I ensure until we are praying saying more now with more support beyond in Sabakana. The Bayer Jumana Yabu, so you try say Hanso Yenya support being free Kroma and Nehonoma in team one in team. The women ask for the support and everything that you guys have been doing. It's so wonderful. We thank you so much.
All right, so that was our CEO, the founder, and the manager of Era One. He's the one that employed me to Era One. So when I come here on Tuesdays and Thursdays, I do my divine connection with Pastor Kron and Professor Linda and all these people. He is the one that paved the way, made the platform available. So please go to YouTube, go to Facebook, and share. Please, when we are broadcasting, come on and to make your contribution, and more so, even if you can't make it. Your contribution will help, please. And I'm not just going to sit here and host him and just say, oh, yeah, I'll also do my portion. You two do your portion. Whatever amount you get is not small or too small. Your $1 may be equivalent to somebody's 1 million. Recently, Jeff Bezos gave somebody, this guy on CNN, 1 million to go and do projects. Can you imagine if he gave it to Dr. Setutu, the things he can do? In God's own time, he will do things beautiful. There's nothing that God cannot do. So please, you've heard us. Don't make us beg, but then do your portion. And I believe if you give a cup to a prophet, God will give you the blessing. And if whatever you do for the least of our brethren, Jesus, if you've done it to him, Jesus is not here to get your money for healthcare. But then he says, if you take care of somebody who is in need or sick, then you have done it unto him. So, we'll close here 4 minutes after 6 o'clock. Doc, thank you very much. I wish you all a very good Memorial holiday for the rest of the day. Please don't eat too much and choke. Don't be subject to CP or whatever it is. Until we come your way again, have a good evening and enjoy. Thank you very much and enjoy your evening. Bye-bye.
Chimafidi nunkotu Era One Radio Samupe Jumpe Dietia Chimafidi nunkotu Era One Radio Ayumpankuma Chintu Asampankuma Chintu Egratumkuma Era One
They are 4 women. They are beautiful with brains. They are eloquent, decent, wise, and experienced. You have heard many, the funny. Now, it's time to hear the experience and the brainy. Meet Selena, Dorcas, Gifty, and Annette as they present the real in common getting. In common BISS chain, the dead, as in Takrenu assume the dead, the real in common getting. Showing live this and every Sunday, 7 p.m. on Era One Radio on Facebook and on YouTube, Era One Radio and on Taibo channel. Kaise, so we see the real in common getting ya. What brabontete, we nyan konkonsa, we the real in common getting.